Month of January is Cervical Cancer Awareness Month, and our Abby Lester went to the Bluefield ER to speak with a radiation oncologist to learn more about why they're raising awareness.
The month of January bringing cervical cancer to the forefront, as doctors work to not only just raise overall awareness, but to inform the public and hopefully save lives.
Cervical cancer is a very big problem in our country and around the world. It's one of the top 15 cancers by prevalence, and it also is fatal for patients that are diagnosed with more advanced disease. And so screening for this cancer is very important. It's been a huge improvement in the outcomes for patients with cervical cancer. Patients nowadays have an excellent chance of being cured of this cancer if it's found early enough.
Bayeston tells us what professionals recommend for screenings.
The current recommendations for cervical cancer screening are starting at age 21 up to age 65, and should have a pelvic exam with a pap smear every 3 years unless abnormalities are found, and then it would likely be more frequent at the discretion of the physician that does the exam.
Comparing numbers in West Virginia to the rest of the country can be daunting.
So thinking about what our problems are locally here in southern West Virginia, with regard to cervical cancer, we have 50% higher incidence of cervical cancer compared to the rest of the country, and we have a 50% higher death rate from cervical cancer compared to the rest of the country. It's my belief that this is, lack of resources, lack of education, lack of seeking out screening, as well as lack of utilization of the vaccination for this type of cancer.
And for those concerned about the vaccine, Dr. Bayeston breaks down the numbers for us.
It's a vaccine that's recommended for young adults, usually aged 11 and 12, but it's also available for folks at least up to age 26. For folks who get the vaccine before age 17, they have a 90% reduction in cervical cancer. Now, that's not just for cervical cancer. That HPV also causes certain kinds of throat cancer, like tonsil cancer and anal cancer. So this is a vaccine that works against at least 3 different types of cancer. So it's an excellent tool that hopefully can reduce the burden of these types of cancers by 90% if we can use it.
To reduce your chances of getting cervical cancer, Dr. Bayeston tells us this.
Just try and do your best to cut your risk factors, and that would, for all cancers, include, tobacco use, eat a healthy diet and exercise, and now we know even alcohol use is associated with cancers. And so do your best to reduce those, but also seek screening, because those are the big home runs we've made in cancer care during my lifetime.
Remember, you want to start getting your screenings at age 21 and at least every 3 years until you're 65. Here for you in Bluefield, Abby Lester, WVVA News.
Now, if you'd like to set up a screening appointment for yourself, you can call 304-327-1570. Again, that number, 304-327-1570. Now,